Hey, Adni fam, it is Anthony, and I am truly honored. Today we have such a treat. We are joined by Kristen Gilmore, who has had such an inspiring nursing career from working in the emergency department to becoming a nurse manager, serving in various nursing roles, and now is the program manager for nurse well-being at Thomas Jefferson Hospitals, and is the immediate past president and president-elect for the Emergency Nurses Association Philadelphia chapter. So, oh my goodness, Kristen, thank you so much for joining us in your busy schedule. We really appreciate it.
Oh, Anthony, thank you so much. The pleasure's all mine. I'm so excited to be here with you guys today, and I'm just very humbled that you asked me to be part of your podcast.
Absolutely. Yeah. I mean, I feel like at Adni, the Adni Huddle podcast, me personally, like as a nurse, I am so passionate about nurse well-being. I'm so passionate about ensuring that all healthcare workers feel supported at the bedside and beyond. And when I saw your role and all the incredible work that you're doing at Jefferson, I was just so excited to learn more about it and like really spread the news about the work. But before we jump into all of that, would love to just start at the beginning. As I mentioned, you've had such an awesome nursing career. Tell us a little bit about that journey and, how you got to where you are today.
Yeah, absolutely. Thank you. So the journey has been a wild one. So I will always, when I tell my story, Anthony, share that my career in nursing has really benefited from having particular opportunities presented to me by individuals. So I always encourage nurses to create connections and, always really recognize those opportunities that are put before you because they're such gifts.
Yeah.
So my story really starts in nursing school. I was in nursing clinicals at Einstein Medical Center in Philadelphia. And it was senior year, and one of my nursing instructors said to me, Kristen, what do you want to do when you graduate? And I said, well, I would love to be an emergency department nurse. And she said, well, would you like to work here? And I said, sure. So she said, well, okay, I know the nurse recruiter, so let's go down and see her. So in my
Wow.
in my nursing school scrubs, I walked down to the nurse recruiter with my instructor, and I met the nurse recruiter, and she said, oh, well, we would love to have you. Do you want to come down and meet the clinical nurse manager of the ER? And I said, sure. So then we walked down to the emergency room so I could meet the clinical nurse manager. And she was fantastic and delightful. And she said, hey, would you like to work here during nursing school and be a tech here? And I said, yes, I would love that.
Oh my
So that is how
goodness.
my journey into emergency nursing really started. So I had the opportunity to become an ER tech at Einstein's Medical Center's emergency department during my last semester of senior year. Learned tons of fantastic skills that really prepared me to become a nurse. And then, as graduation was approaching, a different clinical nurse manager had approached me and said, hey, would you like to work here as a nurse? And I said, I would love to. And he said, okay, walk up to the nursing office, fill out this paper that's next to the door and just hand it in. And poof, that's how I got my first nursing job.
No way. Oh my
Yep.
goodness.
Yeah. So I was fortunate enough to start there, had a fantastic orientation. I learned so much, Anthony, from, in that emergency department. Level 1 trauma center sees tons of individuals who are in need of care. I became very comfortable taking care of the entire spectrum of our patient population, whether it was from birth, because literally sometimes that happened in the emergency department, to,
Yeah.
death. So got to be part of the entire spectrum of life, got to care for so many different people.
Yeah.
And I really enjoyed leadership. I knew that I during my short time there as a nurse, that I really wanted to grow and become a leader. So had the fortunate opportunity to become a charge nurse in their emergency department.
Wow.
And then an opportunity came, and I was fairly young still. I think I was only a nurse for probably about 3 years when the opportunity came for me to apply for a clinical nurse manager position on the evening night shift. And I did. And I was granted the position. So I had the opportunity to start my leadership career next to the same clinical nurse manager who had hired me as a tech, which was really
Wow.
wonderful. Yeah. So really had, again, a wonderful orientation, really began to understand how to be a leader, how to exhibit those leadership skills, how to have really great conversations with folks, but really how to, really engage with my employees and encourage them to move towards their goals and to help them align with that. And then, during that time, one of the techs that worked with me had approached me and said, hey, I know that you really love to teach. You're really good at it. I'm in nursing school now, and our nursing school is looking for instructors. So off I go, and I interview for a position to teach at a nursing school. And who is the person who I'm interviewing with? But someone who used to work where I went to college. She was actually one
Wow.
of our leaders at the college I went to. I went to Holy Family University.
Nursing's a
And
small
this woman is,
world. It's crazy.
it sure is, Anthony. I will tell you, this woman, her name is Bernice. She's still in my life. She's still one of my biggest mentors. I see her every
Oh,
year still. She's since
wow.
retired, but she still plays such an important role in my life. So she gave me my first role with only having a BSN in a nursing school where I had the opportunity to teach both in the classroom and clinical and do critical care. So a fantastic experience I had there. The nursing school closed, so I continued on my ER career and still continue to work at Einstein. But I knew that I still wanted to do a little bit more with leadership. So I applied for a nursing supervisor position at what was ARIA in Bucks County, is now Jefferson Bucks, and had the opportunity to do that. So that was my first time being a nursing supervisor, continued to work the night shift. It was a very different leadership role than I had ever been in before, right? You know, I was used to being a leader of one department, and now here I am overnight being the leader of an entire hospital. So it really gave
Wow.
me a different skill set. Yeah, it gave me a different skill set, a different appreciation for the role that everyone plays in what we do in the hospital and in healthcare. So it was really a fantastic ride during my time there.
Wow.
But it was during my time there that I also was like, you know what? I think I'm ready to go and take on, you know, my own unit. I would love to go back to the emergency room and really start to grow in that space of just, you know, being the nurse manager of a unit by myself. So I did that. I went to a local community hospital, was granted that opportunity. And Anthony, I learned so much about myself as a nurse, as a leader, a person. And I just had so many fantastic opportunities there. During my time there, I learned how to, you know, support accreditation. I went through accreditation with another nurse manager for our cath lab to become accredited. So I got to learn all these new pathways that I'd never been exposed to.
Mm.
And during my time there, the director of nursing had approached me and said, hey, one of our inpatient rehab floors is looking for a nurse manager. I would love for you to cover it during the time while we're doing that search. And I laughed because I thought she was joking, because here I am, I'm an ER nurse. I don't know anything about rehab medicine or, you know, post-acute care. But I will tell you that it was one of the most fulfilling roles that I've ever had the opportunity to do, because it was so different for me. And it was so multidisciplinary, working with physical therapists, occupational therapists, people that I don't typically get to work with in the emergency
Yeah.
department. And the patient, yeah. And the patient population was so
Yeah.
different. So it was just a very rewarding pairing that I got to do that for a period of time. And then I started getting the itch again for, you know, to go back to that trauma level 1, very high acute emergency department. So I applied for a charge nurse position at Thomas Jefferson Center City campus to be a charge nurse in their emergency department. And I was fortunate enough to get that. So I started there, and I just, from there, gained such an appreciation again for what folks do in healthcare. And I've created such a strong sense of friendship from the people that I had the opportunity to work with there.
Yeah.
And during my time there, I got to watch the ER grow and blossom and you know, really embrace new protocols and be very innovative from an emergency
Yeah.
department standpoint. I was able to be involved in, during that time, Ebola was a big looming kind of risk for us. And we had a grant, so I got to really be part of a grant to help develop this biocontainment unit within our emergency department. Had the
Wow.
opportunity to go present at places. So it was, again, just something that I never in a million years would have expected to be, you know, exposed to and have
Yeah.
certainly a new appreciation for. And then, you know, my friends from Einstein came knocking and said, hey, Kristen, we have a nursing supervisor position open at Einstein. We would love for you to come back. And I did. So I went back to Einstein, became a nursing supervisor. COVID happened. Anybody in leadership will tell you, you know, that COVID was particularly very challenging as a nurse leader,
Yeah.
just as it relates to resources, supporting staff. And it was just a time of change, right? Really, really a big time of change. And then my friends from Jefferson called and said, hey, Kristen, we have a position open. It's new. It's going to be an assistant nurse manager kind of position. We would love to have you back. And I interviewed and I really liked the team. So I went back. And then, you know, post-COVID is really what started shifting my mindset as it relates to well-being, Anthony, I will tell you, because I started really noticing during that time a shift in the people that I worked with. You know, I had known them previously and I came back and I was like,
Yeah.
oh, some people kind of are acting a little different. They seem a little bit more stressed, a little bit quicker to respond. The population is a little bit different. I think as nurses, we all agree populations have changed after COVID. I could just see that people were reacting in different ways than they used to. And to give you a little bit of a different context, I'm also married to a paramedic. So
Mm.
I understand, you know, the experiences that they had during the pandemic. And because of who I'm married to, that's kind of who our circle is healthcare, pre-hospital, that kind of thing.
Yeah.
So I started seeing a shift in the folks that were around me, the folks that I really cared about. And I thought to myself, you know, I would really love to do something to give back to that. How can I help people? How can I improve what they're going through? How can I support them in a different way? So I
Mm.
actually began to look into Anthony becoming a certified clinical counselor and going back to school because I figured that would be a really fantastic way for me to be able to serve our community of healthcare providers and pre-hospital folks in a very different setting, right? And it was during that time where I was considering going back to school that our Philadelphia Emergency Nurses Association had a meeting where we invite nursing students to come into the meeting and they meet a panel of emergency nurses. So leaders, charge
That's
nurses, bedside
awesome.
nurses. And yeah, it's really a great experience. And some of our new nurses. So we really just allow folks to just rapid fire questions. Nothing's kind of, off the board and everybody can just, just really feel open to have conversations. And one of the young ladies reached out to me and said, hey, I'm looking to get a job at a local hospital. Would you be able to help me kind of find a job that would fit like what I can do over the summer? And I said, sure. So I went onto the hospital's website, which is also Jefferson, and I found this role for program manager for nurse well-being. And I read the description and I was like, oh my gosh, this is it. Like, this is what I really would love to do. This is the answer. But I'll tell you, Anthony, I read the job, like the requirements for the job, and nothing in that screamed Kristen Gilmore. They wanted something that was very different than who I was on paper. But I said, you know what? I really want this job. This will be a dream for me, and I'm going to apply. So I applied right then and there, hit submit, and then told no one. I didn't tell my husband. I didn't tell my best friend
Wow.
because in my mind, no one was going to call me for this job.
Yeah.
And then they did. And then
Wow.
I got to interview with the CNO, who is my current boss, who is just brilliant to say the least. And we had a fantastic conversation. And then I interviewed for 3 months. I interviewed with panels, with nurses,
Okay,
psychiatrists, people from
wow.
corporate. Yes, it was quite an adventure, I'll say.
Yeah.
And so, going through that journey, and then they called to offer me the job, and I almost didn't take it, Anthony. I almost didn't take it.
Really?
Yes. And my husband said, you have to take this job. You will regret it for the rest of your life if you do not. And he
Hmm.
was 100% right. I've had the role of program manager for nurse wellbeing now for almost 2 years. I serve Jefferson Frankfurt, Jefferson Tarzan, Jefferson Bucks in this capacity. And it has been, to say a dream would be an understatement. I truly love what I do. I feel as though all the things my nursing career really prepared me to be able to serve in this way. But I feel that I'm in a space, Anthony, where, you hear folks talk about like a calling to serve or a calling for a particular job. I
Yeah.
feel like that this is my true calling and that this is where I'm supposed to be. And I am just so thankful and blessed for the opportunity to give back to the nursing community in the way that I've been able to over the past 2 years. So really exciting stuff.
Wow. Oh my goodness. Well, congratulations on such an incredible career. It's truly the perfect example that nurses can do it all. And there really is
Mm-hmm,
such a joy of lifelong learning and having, this growth mindset throughout your career. You can always learn new
mm,
things, try new things, evolve. And I think that your career is such a great example of that. And leaning in, not being scared to go for it.
mm-hmm,
When someone asks you, hey, like, are you interested in this? I think sometimes we can so easily have imposter syndrome or feel scared
mm-hmm.
to take the leap. But I think that you have really, in each part of your career, have really just leaned in, it sounds like. So that's such a great lesson and example for, any nursing student or healthcare worker listening. But what really excites me is, this role that you have today. I think it's so exciting that
Hmm.
you feel so much fulfillment in it. It's certainly such a great crescendo throughout, all the things you've done. I'd love to learn more about your role and what you do as the program manager for nurse well-being. What are some of the initiatives and projects you do? Like, what is a
Hmm.
day-to-day like for you?
Oh, my day-to-days are very busy, Anthony. So I will tell you that I'm a huge believer. We know that a large portion of our nursing workforce right now is new to practice. So
Yeah.
I do try to focus a lot on our new to practice nurses. I actually meet every new to practice nurse, Anthony, in orientation when they first start with us, so they know
Wow.
who I am and what I do. Because in my mind, when you're looking for culture change and you're looking for sustainability, that's where
Yeah.
you really should be starting, right? Is from the moment folks enter into your organization. So that's what I love to do. So we have new employee orientation every other week at our hospital, and I meet
Wow.
our new nurses every other Wednesday, introduce who I am, give them a little overview. I make sure they have my card, because if you remember, becoming a new nurse is a
Yeah.
really overwhelming process. Like,
Super.
you don't you don't know anybody. Everything's very foreign to you,
Yeah.
and your head spins for weeks, right? Like, you're just trying to figure out, how to plant your feet on the ground. So I like them to have my information so they know you can text me, you can call me, you can email me. I'm here to support you. I tell them
Wow.
at the very end of when I meet them, Anthony, is I come to work every day for you. I come to work to serve the nurses. So please use me. So I always make sure I meet them. And
That's
then,
awesome.
we continue on. Yeah, we continue on with that kind of cadence. And with our nurse residents, we have built into their residency mindfulness and meditation practices that I lead with them over an 8-week period. I'm also a certified SMART practitioner, and that's stress management and resiliency training. And through that, what we do is we teach them these skill sets so that they have the ability to really use them as coping skills when they're feeling stressed out, overwhelmed, things like that. So they kind of are with me through their entire nurse residency cohorts. So
Wow.
we're really making sure we interact with them then. Yes.
It's so important.
A large,
Supporting the new
oh,
grads is something I'm so passionate about because been a new grad nurse, it's such an overwhelming time because for the first
mm-hmm,
time, you're trying to learn all this information you thought you learned in nursing school, but you realize, a
yes.
lot of it is actually learned like boots on the ground. And then you're also just trying to navigate your professional ecosystem, right? Like this is really the first time that you've been, kind of colleagues with other nurses, with physicians, with respiratory therapists, with nursing managers. Like there's so many different kind of stakeholders you're kind of
Mm-hmm.
getting exposed to for the first time. So I absolutely love that, from day one, you making sure that the nurse residents, have those resources. That's so incredible.
Oh yeah, absolutely. And it's a priority, right?
Yeah.
Like I feel like it's our job and our responsibility, to be honest, as employers, to invest in our employees and in our nurses. And, I tell a story of, imagine if you came to the hospital and there were no nurses, and what would that look like for you? And I always joke with them and I say, I need you to take care of yourself so that in 40 years, when I'm the patient in the hospital bed, you are
Yeah.
still here to take care of me. So really trying to emphasize with them, Anthony, to your point, from the very beginning of their career with us, like that self-care and self-awareness is so important. I say all the time to them, and they probably are tired of hearing me say it, but the cliche of like, you can't pour from an empty cup. You have to make sure that you're taking care of yourself before you can really successfully take care of others, and trying to reinforce that. We pay
Absolutely.
we pay a great amount of attention to our new nurses. We continue to support our current nurses. A lot of what I do, Anthony, I call them one-on-one sessions.
Hmm.
So I do proactive reach outs, and I'll tell you that is like probably the bread and butter of what I do every day, and it's one of my favorite things to do in my program. So proactive reach outs, Anthony, is essentially I'm reaching out to an employee under that nursing umbrella and saying, hey, I know that you dealt with a stressful shift, a challenging patient, challenging situation, and I'm calling to check on you to make sure that you're okay because we care about you.
Hmm.
I'm not calling to do an investigation. I'm not calling to ask you questions. I'm calling to just allow you a space that's safe, 100% confidential between you and I, to share what you experienced, and so that I can help you cope and move through it.
Wow.
Again, I never want a nurse going home and thinking that they have to sit with a heavy heart with something that they experienced.
Yeah.
So how do I get that information, right? Like, how do I know who these nurses are? So I do a few different ways. Um, I follow up on anybody who might have put a report in about workplace violence. or a medication error, or maybe it's incivility and bullying that they're experiencing in the workplace. I follow up on all those. I also follow up on any sort of workplace violence alerts that we have in the hospital. I follow up with the nurses that were the primary caregivers of those. I have a really great relationship with our nurse managers. I work with fantastic nurse leaders. So they know when their staff is not maybe coming into work the same way they normally do. Maybe their personality has shifted. Maybe they're having some home challenges. So they'll reach out to me and say, hey, Kristen, would you mind reaching out to so-and-so? And I say, absolutely. I have the opportunity as well with at Jefferson to have access to their schedules and their phone numbers. So I can see, hey, did this person work last night? So I try to be very mindful of not waking people up. You know, being a previous night shift nurse almost my entire career, I like to make sure people sleep. So sleep is important. So really, you know, being able to do this proactive reach outs are so important. And I'll tell you, Anthony, in 2023, it was the first year that I had been in the role for an entire year span. And during 2023, I was able to independently, proactively reach out to over 500 nursing employees to support them.
Wow. Oh
yeah. So I love doing that. I spend a lot of my time talking, a lot of my time touching base with people, again, just wanting them to really know that we care about them and that their well-being truly, their well-being is important. And then I also get to do really fun things. So I get to help to develop different programs within the hospitals, again, to support nursing. So we have a really robust pet therapy program here at Jefferson for our Frankfurt, Tarzone, Bucks campuses. We have 13 dogs on our team.
Oh my goodness.
Yes, there is almost always a dog at one of the hospitals every day during the week. We have about between like 25 to 30 hours of animal therapy for our nurses. It's a nurse-facing program, meaning that the pets are there for the nurses. I send out a calendar every month to the nurse manager so they know what dog's visiting with me and what day and what time.
Wow.
We try to make sure, it's so much fun. We try to make sure that we expose all of our shifts. So we'll come in during the day, we come in on some weekends, and then we'd like to do rounds at 6:30 at night. So day shift ends with a dog and night shift starts with a dog.
Nice.
That's a big hit. And all of our pet therapy dogs are certified therapy dogs, and it's 100% volunteer based. So it's all volunteers that bring their dogs to the hospital. We have a whole program and policy written around it, and it's really such an awesome program. We actually did a very small study last year on mood perception, and what we found, Anthony, at our 3 hospitals was that the exposure to pet therapy showed almost a 100% increase in the nurse's mood perception. So it just changes and alters the environment so much. And we're just so thankful for our partners in our pet therapy. We also get to do music therapy. So we're fortunate enough here at Jefferson to have a music for self-care grant from a group called HAP. And we have been granted, oh my goodness, a large amount of money, over $100,000 to be able to do this grant. And what we do, Anthony, is we expose different nursing units chosen by their senior leaders to integrative music therapy kind of practices with a board certified music therapist. And that's been really fun. We do things from just doing environmental music therapy, so essentially having music in the background because we know that that can help with stress and anxiety, to our music therapist, Allie, who is a fantastic clinician. She'll do one-on-one sessions with nurses. She'll do group sessions, debriefings, everything. So again, just a really innovative way to address what's going on in the work environment. And then we have different programs where we do things with different kind of creative arts kind of stuff, where we have coloring murals on a lot of our nursing units for people to go and do these coloring murals, kind of like big adult coloring pages, like they're like 5 feet tall. And people really enjoy that. And some units even invite patients and families to join them in coloring it. So it really has a great impact. We've also been able to create with some of the funds that my role is funded through a grant. So a very generous grant from what used to be the Board of Trustees of what was Jefferson Northeast. And through that grant, Anthony, we've been able to use some of those funds to help the nurses create spaces. And you might have seen these during COVID, like Zen dens, those kind of areas.
Yeah.
So what we've been able to do at 2 of our campuses, another one is currently under construction, almost done. So we've been able to help create these spaces that we call respite rooms. And these areas are meant for nurses to go during, before, or even after their shifts as a space for rest and rejuvenation. And the nurses help me to kind of create it. They pick the wall color. They pick the items that are in the rooms. We have a massage chair that's in the room. So we really make sure that it's an area that's created by them for them.
Love
And I will
that.
tell you that, yeah, I keep metrics to see how many people visit every month. And at one of our hospitals, they've had the room now for a year, our Frankfurt hospital. And they have usually about anywhere between 120 to 150 visits to that room every month.
Wow.
And our Tarsdale hospital just opened theirs back in June, and they have over 200 people that visit it every month. So they're very high use and very welcomed areas. And we have whiteboards in there that people can write, positive affirmations to their coworkers.
Oh, that's
I have,
awesome.
yeah, there's curated yoga and meditations in there so they can practice that while they're in the room if they like. And then we have all of our well-being resources offered through Jefferson. Many of them are no cost to our employees to make sure that they know what resources are there for them. And then, of course, I'm part of different committees and part of different shared governance structures. And I, of course, run our Wellbeing Council for our North Division. So really trying to make sure that we have a presence. We do tabling events. I round constantly with carts and snacks and different Jefferson flag, just to really make sure that, folks know who I am and that I'm available to them. Again, I don't have a department anymore. I don't see patients anymore. I'm just really here every day to support nurses. Super flexible in my schedule. So sometimes I'll be there on the evening shift. Sometimes I'll come in like at 4 o'clock, 5 o'clock in the morning. I'm really just there for when people need me. And again, this role has just been an absolute dream. And I'm just so hopeful that by having the opportunity, Anthony, to do podcasts like this, that
Yeah.
other organizations and other, healthcare groups can really better understand the value of having someone in a role like this.
It's so amazing. And I think, for your role now, it's really like your patients are the nurses. I feel like I've said that
Yep.
so much too, like in how my nursing role has changed and now working, on a tech company that's like building software for nurses. It's like, yeah, I always keep that in mind because I think sometimes you do miss that patient care, but I think when you remember, like the nurses are really our patients now, it is really
Mm-hmm.
fulfilling. But I love what you said
Absolutely.
about, other organizations being able to learn from this because I think that, nurse well-being, in my perspective, can sometimes be viewed as like a nice to have. Like it's like, oh yeah, we'll get to that when we get to it, or oh, maybe there's not a budget for it. But I think from my perspective as a nurse, having actually worked with, the front line during very stressful experiences, when we think about retention and even recruiting cost or, all of these metrics that really impact the bottom line so clearly, I think so much of it can come back to, nurses feeling burnt out, feeling, that lack of support, and being able to kind of institute some of these solutions that you've, just shared that, you're operating at Jefferson, these are really elegant solutions to the problem, right? Like they are incredibly impactful, but the barrier to create them does not have to be, exuberant, right? Like I think that
Mm-hmm.
even something like animal therapy or music therapy is something that really all of us can bring to our organizations. So I guess on that note, I'm curious, like how have you seen, your role as, someone who's leading nurse well-being at Jefferson? Like how have you seen that have an impact on nurse engagement, retention, and overall kind of the stability of your clinical workforce?
Yeah, that's a great question, Anthony. So to your point, it is a nice to have, right? Like a role like mine in the past has been considered that, and maybe in some organizations it would still be considered that. I think it's important to note that you can be creative in creating roles like this. For example, I did mention earlier that my role is through a grant. So my CNO knew that she needed to be innovative. She needed to look outside of the traditional model of, an FTE kind of position. So she has now successfully obtained 2 different grant positions for roles like this. I'm so excited that I'm going to have
Wow.
a partner at 2 other hospitals at Jefferson. She just
Nice.
started recently, so I'm excited for that. That gives me hope that this is going to continue to kind of move forward. But to answer your question about how can it be impactful, so we know that, like, I just read a recent study where it talked about that, here in 2024, nurse turnover for every nurse that leaves the bedside, it costs at least $67,000, right, to replace. And we know that there was a recent study also done that the CDC published that talked about healthcare providers. About half of them were looking for new jobs. So that's staggering when you think about what our workforce is, where we're already struggling, and now to think about more folks leaving it. And I think that that's why having roles like mine is so important, so that folks know that as a healthcare organization, you care about them as an individual. And that's what I really try to stress. Even when I'm talking to nurse leaders, I'm not talking to them about, FTE management or how to have crucial conversations. I'm talking to them about taking care of themselves from a holistic perspective, recognizing that their mental health is going to impact their unit, which is going to impact their
Yeah.
nurses, which is going to impact the patient care. And it's really just very simplistic, Anthony, of stepping back and recognizing. You used the word ecosystem earlier as it relates to healthcare. And it's really true that it is, because you have to think about the impact that your well-being has on the person next to you. And we
Yeah.
know that that trickles down to our patient bedside, right? So
Yes.
by investing in just the general well-being of your staff, having someone that folks know that they can go to talk to in a confidential space, or knowing that they can come to someone to help them with professional growth and development. I've been a leader. I hold multiple board certifications, so I can most certainly help folks in that space. Really using someone in this role as an untapped resource for your staff. And that happens a lot in the workspace. If someone's experiencing home life situation, a domestic violence home situation,
Yeah.
they want to go back to school, things like that, I'm always there to be able to help them, to get them resources. I'm available very, very often. I do have problems with letting go of my cell phone. I will admit that it's, for my well-being, I should be a little bit more detached, but my work is so
Yeah.
important to me that,
Oh,
people know they can just text me, and then I'm really just here to help them. So I think that
wow.
investing in roles like this, Anthony, over the period of time, you'll start to see changes in your culture engagement, right? Because we talk a lot about well-being in a lot of organizations as it relates to their employee engagement surveys that they do, the typical ones that folks do every year. I think you'll start to see differences in that. You'll see differences when you create a role like this. You're able to do, different programs related to reward and recognition, because we know that recognition is really important to folks in healthcare and staff members. You'll see a shift in that. We've already seen a shift in that here at Jefferson over the past year. We've seen an increase in our employee engagement as it relates to feeling recognized and appreciated. And I think that you'll start to see a shift in retention. I think that I'm hopeful that we're going to start to see a little bit of a balance in where we're at with nursing. I think that, there's a lot of creative, I'm sure you see this in your role, that you see a lot of different creative kind of ways for nurses to work in healthcare, and particularly the hospitals are becoming very, they're very out of the box thinkers in how we're going to take care of our patients. So I
Yeah.
think you'll start seeing that kind of improvement when you start to implement roles like this. And then when you also start to implement simple things, like I mentioned, like the different therapy adjuncts that are so easy to do.
Yeah.
I was just on a meeting prior to meeting with you today, and it was about our music therapy program. And one of the nurse leaders said, is there plans for us to expand this to every hospital? Because every hospital should get to have this all the time. And it just makes me so happy to hear that, because the buy-in, because sometimes people don't necessarily always buy into the well-being stuff. Sometimes they think it's a little hokey.
Yeah.
And if I had to tell you, Anthony, if you told me as an ER nurse like 5 years ago that I was going to be teaching mindfulness and meditation, I would have told you were crazy. But there's so much impact in all of that, and I think that hospitals are going to really start to recognize the value of that. And I think by having roles like this in organizations, you will truly start to see over a period of time an impact on the workforce, on the retention, on the turnover, and on the bottom line.
Absolutely. Yeah. I mean, I think you're so right. I would echo everything you said. I feel like rewards, recognition, just having someone there to check in on staff, to be there as a resource, it can have such an incredible ROI for healthcare organizations, even if they can improve retention slightly, or, help ensure that new grad nurses are staying in with the organization and building that loyalty. I think it's
Mm-hmm.
really, it's really a no-brainer, right? Like, I think really investing in the
Mm-hmm.
workforce and ensuring they have the support is just so vital for patient care and everything in between. One thing I would love to pick your brain on is, as we kind of wrap up
Sure.
here, is really just any advice you have for any healthcare workers listening, any nursing students listening who, maybe are feeling a little bit burnt out. They maybe don't know how to navigate the resources at their organization. They don't know really who even is there to turn to. What would
Mhm.
be your advice to them in ensuring that, we're really prioritizing self-care and also advocating for, our needs?
Yeah, absolutely. So I think nurses through the spectrum of their career, we all need something or someone to support us at some point in our career. So I think the first thing, Anthony, is to break the stigma, right? That it's okay for us to talk about what we're experiencing, what we're feeling.
Yeah.
Something I tell a lot of our new to practice nurses is I try to remind them, what you see as a nurse, most eyes don't see. Most humans aren't a part of the things that we are, privy to as healthcare providers. They don't
Yeah.
see, sometimes the impact of violence or the impact of um, poor health or socioeconomic issues. So sometimes, just really taking a moment to appreciate that, to give yourself a little bit of grace. The things that you see are so abnormal, and it is a
Absolutely.
normal response to feel sad, angry, upset, or just you don't even know what you feel, but you know that you feel overwhelmed and that you're not feeling how you normally do. So I think recognizing that it's okay to feel that way, and supporting each other and knowing that we should be talking about it, that having conversations is so important. I will tell you, I've been a nurse for 20 years now, and I was brought up in the era of, like, you see something bad, you pull up your big girl pants and you move on into the next room and you pretend like it didn't happen. And
Yeah.
and what you see in that is you saw burnout, you saw people that unfortunately look to other coping skills, probably unhealthy ones, to deal with what they saw. And we didn't really do a great job with supporting our own mental health, let alone the person who was sitting next to us. And I'm
Yeah.
so proud of this current generation, Anthony, because they are so willing to talk about what they're feeling, what they're experiencing. They're open and they're curious, and they're very, really just open is such a strong word for it, to have these conversations. So kudos to the current generation, because they're breaking the stigma. But I
Yeah.
think, recognizing that you need to talk about it. And then your question was, how do they find out who to talk to? Like, where do they go? We just did something recently with our nurse residents. Someone did a project where they looked at, the impact of nurse residents supporting each other, like having their own little peer-to-peer support group. And they found it to be incredibly impactful to know that they could call their peer and say, I had a really bad shift last night and I need to talk about it.
Yeah.
So I think if you're a new grad and you are in nurse residency and you have these kind of support programs already in existence as it relates to the residency program, I think looking into into the people that are sitting next to you and tapping into that is fantastic. I
Absolutely.
think, talking to your nurse leader sometimes about what are the resources that we have here. But at the end of the day, the folks who will always know about all the well-being resources are your human resource partners. So find out where human resources is at in your hospital and ask them, what resources do we have to support our well-being? You'll be surprised how many resources organizations have to support
Yes.
not only your well-being, but like the people that live in your home. A lot of times they'll support those folks as well. And many times they're free. And I will tell you that the resources that we have at Jefferson are incredible, and that we have really great partners that we work through with that are third party, that have been such great support systems to our nurses. So look for those resources. And then, the American Nurses Association has something called Healthy Nurse, Healthy Nation. I think that there's tons of amazing information that's out there to help support you. Some of it's evidence-based. There's blogs, there's suggestions. There's even something you can sign up for where it texts your phone every so often to remind you of a challenge, whether it's hydration, sleep, exercise. So, getting involved in professional organizations, because again, they're organizations that are there to support you as a nurse. So most certainly they're going to support your well-being. So look to your peers, look to your organization, and then look to your professional organizations to say, how can we best be supportive? And at the end of the day, if you can't find any well-being resources in any of the three things I said, Anthony will share how to get a hold of me, and I'll be able to help. I will be happy to help any of the nurses out there that need some support.
Oh my gosh, that's amazing. Yes, there's lots of resources I think that, sometimes folks don't even know exist at their organization because
Mm-hmm.
sometimes, it can be overwhelming to find. It's a little bit disjointed.
Mm-hmm.
So I love your idea of like going to the HR team, asking your nursing manager, asking your peers, and also, reminding your peers to use resources as well. And I think that is really the future is getting through it together, which kind of is the
Hmm.
perfect segue into my last question. We always end the Adni Huddle podcast with the same question, which is kind of about Adni's individual mission of unity in healthcare. And really, this concept that, we're stronger together when we all support each other, when we all come together, all the resources, all the tools, kind of unified. So I would love to hear from you. Why do you believe that unity in healthcare is more important maybe now than ever before?
I think unity in healthcare is important now than it ever was before, particularly post-pandemic, because of what we've gone through in the pandemic, right? We could have never, for those of us who experienced the pandemic, we could have never gone through that alone, right? We came together in your organization as a group of nurses. We came together as a profession. I think that nationally and even from a world perspective, we were viewed in a very different way as this beautiful, and we are beautiful and amazing group of individuals. And I think to continue to be able to carry the torch, to be able to continue to care for patients for the next thousands of years, I hope, we can only do it together, and we can only do it by supporting each other. And that's, really a platform I stand on. You see that there's the RISE team is in my background. That's a peer-to-peer support group. And it's really meant, to support, we support each other through our peer-to-peer sponsorship and support groups. And I think that that's where unity comes in, that without supporting each other, we're not going to be able to push forward, because we're only as strong as the person who's standing beside us, right? And we're holding up this world of healthcare, and we need all those arms to be very strong. So we need to really invest in each other. And I think, the well-being space is such a wonderful, wonderful place to allow us the opportunity to continue to support nursing and the profession in a very different way than we have before.
I love that. Such an amazing way to conclude. Rise to support one another. And, I think really just to prioritize nurse well-being across the world and having that message be shared and really amplifying that. So with that, thank you so, so much, Kristen, for joining us on the Adni Huddle podcast. You are such an inspiring nurse. Your career is so inspiring. So I know everyone listening is just so excited to bring nursing well-being back to their communities, back to their organizations. And just thank you so much for everything you've done for our profession. It's really incredible.
Well, thank you, Anthony. Again, thank you so much for this opportunity to be able to share my story, but also to share just how amazing, the opportunity of having this type of role in an organization can really be, and the impact it can have.
Absolutely. And congratulations on being the president-elect for the American Nurses Association. Go ER Nurses, Philadelphia chapter.
Yes.
That's so awesome.
Yay.
It's amazing. All
Thank
right.
you so much.
Thank you for listening, everyone.